Okay, welcome everyone. Thank you for tuning in to a short video training on applying for public benefits in Kentucky during the COVID-19 crisis. We've got an all-star selection of Kentucky advocates who have worked on public benefits for a long time, and we're really excited to put this on as a resource to not only directly impacted people but advocates who are helping directly impacted people access these critical benefits during this global health pandemic that we're all living through. So we are going to walk through a couple public benefits, but not all of them. So just up front, want to make sure to say that there will be contact information at the end of this webinar training. If you have any questions or if you need any assistance, please do reach out to one of us and we'll try to answer your questions or connect you with someone who knows the answers. So, as I said, all-star lineup. First, we've got Miranda Brown, the outreach coordinator from Kentucky Equal Justice Center. Hey, Miranda. Next, we've got Chelsea Nickham, the SNAP outreach specialist at God's Pantry Food Bank. Welcome, Chelsea. Stephanie Langeth is joining us. She's the Economic Stability Unit Manager at Legal Aid of the Bluegrass. Hey, Stephanie. We've also got Betsy Davis Stone, Health Law Fellow at Kentucky Equal Justice Center. Hey, Betsy. And then we've got Angela Zeke, the Public Benefits and Ombudsman Unit Manager at Legal Aid of the Bluegrass. Hello, Angela. And then lastly, my name is Tyler Offerman. I'm the Food Justice Fellow with the Kentucky Equal Justice Center. So, like I said at the top, we will be covering some critical public benefits during this global pandemic. There are others, but in the interest of time, we wanted to focus in on these three specifically. So accessing healthcare, we'll talk a little bit about Medicaid and Affordable Care Act plans, talk about SNAP and accessing food, the Supplemental Nutrition Assistance Program, and then we'll talk about unemployment insurance to access benefits after losing work. So just a real quick overview. When we say public benefits, we're talking about the social safety net. So oftentimes folks think about maybe one or two of these programs, maybe it's SNAP, maybe it's Medicaid, but all of them are supposed to work together to form a net, a safety net that's meant to catch people in this country when they fall in hard times. We think every Kentuckian, whether black, white, or brown, deserves help and to have their basic needs met during a dire crisis. Anyone dealing with a dire crisis deserves to access this safety net. That's why it exists. And many more Kentuckians are being pushed into a crisis because of this pandemic. So we will dive on in. So first off, I'll hand it over to Miranda and Betsy to talk with us about getting and keeping health coverage.
Great, thanks, Tyler. So a lot has changed for Kentuckians' access to healthcare because of COVID-19. On the federal and state level, some changes have been made to improve access to care. And if you would change the slide, I would like to, so this is, I'm Miranda and Betsy's here as well. So we're both application assisters, and we'll say a little bit more in a little bit about what that means, but we can help you. And there are lots of people like us working at different agencies, and we can help you apply for health coverage if you need that help. So next slide. I want to start by reminding everyone of a few rights that you have to access healthcare. First of all, if you don't have health insurance, you cannot be denied getting it. If you want to get health insurance, you can't be denied it because of a pre-existing medical condition. And that's part of the Affordable Care Act, which is what a lot of people know and refer to as Obamacare. But that's still the law. Additionally, all health insurance plans, whether it's Medicaid or a marketplace or healthcare.gov plan or a plan through your employer, all health plans have to cover a set of 10 minimum essential benefits. So I'll say real quickly what those are. Walk-in or outpatient ambulatory patient services, emergency services, hospital care, maternity and newborn care, mental health and substance use disorder services, prescription drug coverage, rehabilitative and habilitative services, lab testing and x-rays, preventive care and wellness services like help with chronic diseases, and pediatric services. So no matter what type of health insurance you have, these should be covered. And specifically during this time, COVID-19 screening and testing is covered by your health insurance at no cost to you. And that's part of it's the Families First Coronavirus Response Act, and also that as amended by the Coronavirus Aid, Relief, and Economic Security Act, what people call the CARES Act. These laws require private insurers to waive an insurance plan members' cost-sharing payments for COVID-19 testing. And what that means is that there are no copays, deductibles, or coinsurance for you to get screening or testing for COVID-19, no matter what health insurance you have. So next slide. So we're going to be talking quite a bit about Medicaid in these next few slides. So just an overview, Medicaid is a joint federal and state program that provides free or low-cost health coverage to millions of Americans, including some low-income people, families with children, pregnant women, the elderly, people with disabilities. The federal government provides a portion of the funding for Medicaid and sets guidelines for the program. So during the pandemic, if you have no health insurance, the fastest way to get it is by filling out the Presumptive Eligibility application. Presumptive Eligibility is a temporary form of Medicaid. So as I go on, if I refer to temporary Medicaid, I'm talking about Presumptive Eligibility Medicaid. So anyone who's uninsured and under age 65 may qualify for this temporary Medicaid. There's a couple different ways you can apply. You can go to benefind.ky.gov, and that's benefind, like find your benefit, benefind.ky.gov, or call the Kentucky Healthcare Consumer Assistance Line, which is 1-855-459-6328. And I'll be putting that phone number up several times on these slides. So during the pandemic, you can get Medicaid if you lose your job. The state has made changes to Medicaid eligibility so that this application is fast and easy and more people will qualify for it. And they'll take your word. Typically when you apply for Medicaid, you may have to prove your income, submit documents to prove your income or other information. But right now, because of the pandemic, the state agency staff have been instructed to accept your own statement as proof of income for Medicaid. And then if you get this type of Medicaid and you want to find a medical provider that accepts it, you can call 1-800-635-2570 or go to the website on the screen to find a doctor or clinic or wherever that accepts this PE Medicaid or temporary Medicaid. So also during this pandemic, no one currently on Medicaid will lose their benefits unless they enroll at their own, disenroll, at their own request or move out of state. So Governor Beshear has extended Medicaid benefits by 3 months. So if you normally would recertify your Medicaid in May, your coverage has been extended to August and you don't have to worry about it just yet. All Medicaid copays and prior authorizations are suspended during this time. So I mentioned that you could apply for temporary Medicaid on benefind.ky.gov. This is the website. And this is actually the website for applying for any state administered public benefits in Kentucky. So that would be Medicaid, K-CHIP, which is like Medicaid, but for children in families with a little bit higher income, SNAP or food benefits, K-TAP, cash assistance, child care assistance, and Medicaid waiver services. All of those applications are connected through this website. And you can actually create an account on Benefind and apply. Generally, if you were to do that, you would click on the green Let's Get Started button and create an account. However, right now, if you pull up this website, you'll see at the top that red line, that red banner, and that can be for people needing temporary health coverage because of COVID-19. So it says to go to the bottom left of the screen under Assistance Programs and click on Health Coverage Application in green, Healthcare Coverage Application. So that's why I circled that in red. So if you click on that link, it will take you to a one-page application for temporary Medicaid. So that's the next slide. So this is what the application looks like for presumptive eligibility or temporary Medicaid. This is that quick and easy application I referred to in the earlier slide. That the social number field is marked with a red asterisk, like it's required information. However, it's not required, so advocates in Kentucky Equal Justice Center and Kentucky Voices for Health, we've been asking the state to remove the red asterisk and make that an optional field. If you get assistance, if you get assistance with your application, whereas you don't fill this out yourself, but you get somebody to help you do it, like an application assister, we have another way that we can help you submit the application through Benefind, and we wouldn't have to include a social security number. But if you actually go to Benefind and click the link and pull this up on your own, this is what you will see. So this application does not ask for detailed income information. It does ask you if you have, it does not ask if you have health insurance, and it does not ask for detailed personal information such as immigration status. This type of temporary Medicaid coverage will last through June 30th, 2020. At least that's the current expectation. And then once you have temporary coverage through this application, then you can fill out the full application on Benefind to see if you're eligible to stay on Medicaid past June 30th. But that's a longer application. So next slide. Great. If you already have health insurance through what we call the marketplace, which is you may also know as healthcare.gov, then this may be a time for you to think about if you need to make any changes to your application. So if you don't know what healthcare.gov or the marketplace is, that's okay. If you have it, then you should know what it is. Some people have marketplace or healthcare.gov coverage. Usually if you're under 65, make much money for Medicaid and don't have a plan through your employer, this is an option for you. And the marketplace offers cost savings to make private health insurance more affordable. So that's its purpose. So if you have a marketplace plan and your income has changed, then you may be able to change to Medicaid, which is free, or to a lower cost marketplace plan. You can report an income change on your marketplace application, which you can access by going to healthcare.gov, logging in and finding your application, or by calling either of these numbers on the screen. The first number, the 1-800-318-2596, that is for the healthcare marketplace, so that's the federal call center. And the second number is the same number I showed earlier for general help with signing up for health coverage in Kentucky. Next slide. So while we're talking about the marketplace, I want to cover that these are other examples of changes you might report on your healthcare.gov application. If any of these changes happen to someone in your household, you can report the change to the marketplace, and doing so may make you eligible to change your plan or switch to Medicaid. So this is called special enrollment because it can happen at any time of the year, not just during the open enrollment period. Some other examples of changes that could cause a special enrollment are loss of minimum essential coverage. That would be like if you or someone in your household lost an employer plan or COBRA, gaining a dependent or becoming a dependent, marriage, permanently moving, being released from incarceration, a change in citizenship or lawful presence, and these are just a new payment assistance eligibility. That would be if your income changed enough to change how much cost savings you could get on the marketplace. So these are just the most common changes, but there are others, and every situation is unique. Usually special enrollment periods are 60 days from the date of the change. Sometimes you know the change is coming, then you can report the change ahead of time. For example, if you know your partner's health plan through their job is ending on May 31st, then you can report the change now, and you have until May 31st, but also 60 days afterwards to enroll in a marketplace plan or change from one marketplace plan to another one. The earlier you report a change, the more likely it is that you will avoid a gap in your coverage. So next slide, and Betsy, would you cover how people can get help?
Yeah, absolutely. So Miranda mentioned that if you want more information about, or you want somebody to help you through the process of getting Medicaid or signing up for a marketplace plan, you can get a free application assister. There's a website there that you can go to where you can pick an application assister, or you can also call the number that's there, that 1-855 number, to have somebody assigned to you. And that person should kind of walk you through the process. If you're denied Medicaid for any reason, and you think that that decision is wrong, and Miranda mentioned earlier that nobody should be terminated from Medicaid currently, that started March 18th. So if you lost Medicaid coverage after March 18th, you probably lost Medicaid coverage incorrectly. So if you think that you were denied Medicaid coverage, or you think that your healthcare.gov plan should be less than it is, like you should qualify for more cost savings than the system says that you should, you might want to start by contacting an application assister. That's free. So is the legal aid option that I'm going to talk about in a second. But that application assister might be able to get you re-enrolled or do a new application more quickly than you can appeal it. They might also give you a little bit more information about what your options are. But if you really need to appeal the decision, please be sure that you look at the documentation that you have about stopping your coverage, and make sure that you apply for that appeal in time. There are normally time limits on all of those things, and it's best if you file your appeal in that time period. But legal aid programs across the state, there's one that covers every county, so wherever you live in Kentucky, can also help with appeals sometimes. And there's a website down there, kentuckyjustice.org. And that website is going to direct you to, based on what county you live in, what legal aid program you need to call.
Great, thanks, Betsy. So many, that contact information for an application assister, that's one way to get one. There are local application assisters at local agencies around the state, at places like Community Action or health clinics, so you can always call them directly if you're already familiar with them, or you can call this 1-855 number or go to the website to find someone. So the final slide for us, Betsy and me, is information important for immigrants specifically. And I have two major points here. One is that emergency Medicaid may cover COVID-19 testing, evaluation, and treatment, because COVID-19 could reasonably be defined as an emergency. Patients can apply at the hospital or get an application at their local Medicaid DCBS office within 3 months of the emergency happening. So you don't have to apply right away, but there is a time limit. And other important coverage options for immigrants that are in place regardless of the pandemic, but could be important for you now, are that pregnant women can get temporary Medicaid for up to 2 months of their pregnancy. And pregnant women can apply through participating healthcare providers. Also, all hospitals receive federal funds, what are called DSH or DISH funds, which just stands for disproportionate share hospital. But basically all hospitals have funds to treat low-income people. These are federal funds, and hospitals may screen people for this specifically, or just use the funding to screen people for their own financial assistance or charity care programs. And then also, as part of the FFCRA and the CARES Act for COVID-19, the U.S. Department of Health and Human Services will provide claims reimbursement to healthcare providers, generally at Medicare rates, for testing uninsured individuals for COVID-19 and treating uninsured individuals with a COVID-19 diagnosis. So hospitals choose to use these funds to treat the uninsured with COVID as long as these funds don't run out. So there are funding there's funding available to people who don't have insurance. And then the final point here is that the United States Citizenship and Immigration Services, or USCIS, has announced that they will not consider COVID-19 testing, prevention, or treatment in the public charge test against immigrants. So the public charge rule changed in February, but the rule does not affect all immigrants. Many other programs and services are also not considered as part of this rule. Just to name a few, WIC, emergency Medicaid, disaster relief, and school meal programs are not considered for the public charge test. And if you are an immigrant or a service provider who serves immigrants and you are concerned about public charge, I would encourage you to consult with an immigration attorney. You can find one if you don't have one already at immigrationadvocates.org. They have a legal directory. They have one specifically for nonprofit attorneys. That was immigrationadvocates.org. And there's also more information in general about public charge and what your rights are at protectingimmigrantfamilies.org. Again, that's protectingimmigrantfamilies.org. So that is all the information that I wanted to cover.
Great. Thank you so much, Miranda and Betsy. We are going to move along into our next public benefit area, in which we'll be talking about SNAP, the Supplemental Nutrition Assistance Program. And I'll hand it off to Chelsea and Angela.
Thank you. The Supplemental Nutrition Assistance Program, also known as SNAP, and formerly known as food stamps, is a program administered by the USDA. It provides a nutrition benefit to individuals and their families to help them to purchase food. Next slide. SNAP benefits can be used to purchase eligible food items in stores that are authorized by the USDA to accept benefits. Typically, stores will post a sign which indicates that they accept SNAP. These signs may state EBT accepted. EBT, or electronic benefits transfer cards, are issued to SNAP eligible households, and they work very similar like a bank debit card. Benefits are uploaded monthly to be used by the recipient. Items that can be purchased with SNAP benefits are food items intended for human consumption, seeds or plants to grow food intended for human consumption by the household, and non-alcoholic beverages. SNAP benefits cannot be used to purchase hot foods such as fried chicken or other hot deli items at a store, pet food, vitamins or medications, household products that include laundry detergent or paper products and cleaning supplies, tobacco products, and non-alcoholic beer. Next slide. A SNAP household is defined as any person, family, or group of people who live with one another and purchase and prepare food together. A spouse of any household member, a parent living with a natural, adopted, or stepchild who are age 21 or younger, and children younger than 18 who are dependents of an adult household member are considered a part of the household. The household, therefore, can be made up of both relatives and non-relatives. There are some exceptions to that particular rule, and one example would be an elderly individual that is age 60 or older, and a disabled individual who's been declared disabled by the Social Security Administration. Those individuals, along with children over the age of 22 and older, can be their own household. There are some other exceptions to that household rule, and those can get a little confusing. So really the best policy here is to apply for benefits and then work out all of those details about who is part of your household a little bit later on. And we're going to talk about how you can seek help if that happens to be an issue. Next slide. In order to be eligible for SNAP, the household must meet specific income and resource guidelines. The income guidelines typically increase every year on October 1st. The guidelines you see on your on the slide currently are the 2020 income guidelines. Counting income for SNAP is very confusing. Not only do the recipients are required to meet the gross income limit, but they're also required to meet the net income limit as well. Currently, there has been a change in light of COVID-19, but also going into the future, in which all households must have income within the 200% gross income limit, which is highlighted on the screen in red, and they must meet the net income limit based on the household size as well. We're going to discuss a little more in detail how income is counted and how we use deductions to make individuals eligible for SNAP a little bit later on in the presentation. Next slide. For 2020, elderly and disabled households must have resources at or below $3,500. All other households must have resources at or below $2,250. Resources are defined as cash on hand, money in checking and savings accounts, CDs, stocks and bonds, equity lines of credit if they are used, and a few other resources that are not widely held by people with lower income. Again, there are some exceptions with the resource rule. For example, the stimulus payment that people are currently receiving, that is not considered a resource or income, and a home and its goods and burial plots are not considered income or not considered resources as well.
What is needed to apply for SNAP? Gross income earned or unearned. This includes wages, unemployment, which is a big one right now, child support, income, Social Security, stuff like that. Household size and composition, which is basically the size of your household, how many people are in it and their relationship to you. Proof of Kentucky residency, identity, including a picture ID or driver's license. If someone does not have a picture ID, there are other forms of identification you can use. Citizenship status, but only for those applying for benefits. So for example, if a parent does not have legal immigrant status, but their children are citizens, the children can receive SNAP and the parents do not have to report their own immigration status, only that of the children. Optional needed to apply depending on your situation would include shelter expenses, such as rent, mortgage, property taxes, homeowners insurance. And if the household does not turn in this verification, the case will continue to progress without allowing for the shelter deduction. So if that is something that people have, it's definitely important that they turn it in on time. Actual utility expenses, medical expenses if you are over 60 or receiving disability, and I'll talk about that a little bit more later. Student status, legal child support, the application calls it court order child support, dependent care for adults or children, and disability status. Next slide, please. So there are a couple of programs that are available to assist with SNAP applications: God's Pantry Food Bank, the SNAP Outreach Specialist, that's me, Chelsea, and that's my office number there. And I do SNAP applications assistance for Central and Eastern Kentucky. We have a 50 county service area. If you need to see that, I should have included the website, but you can go to godspantry.org/help and you can see our service area there. And then Legal Aid of the Bluegrass also does SNAP assistance for disabled and elderly individuals, and that's their phone number on there, the 1866 number. You can also call the Department for Community-Based Services, DCBS, at 1-855-306-8959. You can complete a paper application, which is found at the first website listed, or in another language. There's several different languages available for SNAP applications on the second link. Paper applications can be submitted with documentation. You can fax it to either of those fax numbers. You can email to returnproofverif@ky.gov. Make sure you don't type in the Y in verify. I've had several people have problems with that. Or online through benefind.ky.gov. Here's another picture of Benefind here. I actually don't use online applications as much. I mostly stick with paper applications, but I do check for eligibility on Benefind. If you would select that green button on the left there to check for eligibility, it's like a quick pre-screen, so it doesn't require all of the information that a full application would, but that can give you a good feel if you're not sure if someone would qualify or not. And then if you do want to apply with Benefind, you can go to the Let's Get Started button and you can apply for SNAP and other benefits that way. Some things to be aware of. I mentioned medical expenses. If you are disabled or over the age of 59, if you have medical expenses that exceed $35 a month and are not covered by insurance, those expenses can be deducted. When people deduct these expenses, it can help them get more back in SNAP benefits, or it can help those who may be right at the limit and haven't qualified before, but if they're paying a lot in medical expenses, it can help them to qualify. Drug felony convictions may disqualify people from receiving SNAP unless they are currently participating in or have completed a treatment program. There are work requirements typically. Right now during the state of COVID, those are not active, but with certain exceptions, able-bodied adults 16 to 59 must register for work, accept an offer of suitable work, and take part in an employment and training program. And then able-bodied adults without dependents, or ABODs, who do not have children and are not pregnant, can typically only get SNAP for 3 months in a 3-year period unless they are working at least 80 hours a month, which comes to 20 hours per week, or if they are in a work or workfare program, and there are other exceptions to that as well. And then students, most able-bodied students aged 18 to 49 enrolled in college or training programs, workforce programs, may not be eligible for SNAP benefits. The most common exceptions to that is if they are working 20 hours per week, caring for a dependent under the age of 6, or participating in a work-study program that's federally or state funded. And there are other exceptions to that as well. During COVID-19, so medical expenses are still as they are. We are seeking guidance about removing the drug felony ban because of the COVID-19 state of emergency. Currently, there's nothing that's come of that yet, but we're working on it. Work requirements have been completely discontinued during the state of COVID-19, but unfortunately, it has been asked if we can discontinue work requirements and others for students, and FNS has said no to that. So that is going to be still in place as well.
Sometimes individuals will be denied benefits or have benefits terminated wrongly. Should this happen, the individual can file an appeal. The appeal must be filed within 90 days of the date of the notice. And if the person or household is receiving benefits and those benefits are being terminated, they can request a fair hearing. And if they do so within 10 days of getting the notice, the benefits can continue pending the hearing decision. The individual should make sure to request those continued benefits, however, when they are calling to request their hearing. Information about the appeal process will be included in the denial or the termination letter. However, individuals have the right to be represented at that hearing. They should call their local civil legal aid provider for advice and assistance. For a complete listing of those civil legal aid providers, you can visit kyjustice.org and be able to find the contact information for the civil legal aid provider that is over your county.
Great. Thank you so much, Angela and Chelsea. So we'll now move into discussing applying for unemployment insurance during the COVID-19 pandemic. Myself, Tyler Offerman, will present with Stephanie Langeth to talk about this, and I'll go ahead and hand it over to Stephanie to start us off.
Hello, this is Stephanie Langeth. I'm with Legal Aid at the Bluegrass, and I hope that you can hear me all right.
Yep.
Okay, good. So we're just going to discuss a little bit about unemployment benefits and how to apply for them. Unemployment benefits are there as a safety net, and there are benefits that are administered by the state that provide weekly or biweekly cash benefits to individuals who have, lost wages or become unemployed. Can you go to the next slide? So there have been some great changes to unemployment due to the coronavirus. Kentucky has expanded eligibility to many people who are not traditionally eligible for unemployment. So self-employed individuals, independent contractors, employees of religious organizations, substitute teachers, gig workers, people who have worked part-time. They've really opened this up to a lot of people who would never have been eligible before. So you can possibly be eligible for benefits if you've been laid off, if you've had a reduction in work hours, if you're unable to work due to COVID-19, such as if you are, if you suspect that you might have the virus or you're waiting for a diagnosis, if you're taking care of a household member that has been diagnosed with it. This one hits a lot of people. You're providing care for a child or other household member who can't attend school or work because it's closed due to COVID-19. You're quarantined per the advice of a healthcare provider. Or if you were scheduled to start new employment and you could not as a direct result of COVID-19. So really, it opens the door for people. The weekly benefit amount that unemployment pays is based on a percentage of what someone's earned in their last 4 quarters. But in Kentucky, the benefits range anywhere from $39 to up to $552 a week. And they used to only last for 26 weeks, but because of the CARES Act, it's been extended to a period to last up to 39 weeks. The CARES Act also approved for the federal government to pay an additional $600 a week until July 31st. This payment is in addition to your regular unemployment benefits. So there will be some people who make more money drawing unemployment than they did when they worked. So it's a really, really great benefit program. Next slide. So just to kind of reiterate, who can apply for unemployment benefits? Pretty much about anyone. If you're self-employed, a substitute teacher, freelance worker, the list goes on. So if in doubt, my suggestion is to apply. The governor made these changes and we have really benefited from it. So a lot of people have asked us, do I have to search for a job while I'm receiving unemployment benefits due to the coronavirus? And the answer to that is no, you do not. While we are under a state of emergency, the work search requirements have been suspended. So that's a very good thing for everyone to keep everyone safe. Can I apply for unemployment benefits if I am a DACA recipient? The answer to that is yes. Assuming you meet all the other requirements, your status as a DACA beneficiary should not affect your filing process, and you should qualify for unemployment insurance.
Yeah, and this is Tyler Offerman. Just to add here, if you do have questions about your immigration status and if you do apply for unemployment, since there are many different types of immigration statuses, please do contact an immigration attorney just to clarify.
So how do you apply for unemployment benefits in Kentucky? The best way to do that currently is on the Kentucky Career Center's website. If you cannot use the internet or a computer or not successful doing so online, you can call, and their phone number is listed on the slide here. They're asking that you only apply on a specific day based on the order of your first letter of your last name. And that's listed here. So people with the last names that start with A through D can apply on Sundays and so on. If you miss your day to apply, you can apply on Friday. Another change they made was that they got rid of the 1 week waiting period. So as soon as you are unemployed or had a cut in hours or lost your job due to COVID-19, you should apply immediately. Don't delay the application. Next slide. This is the website for the Kentucky Career Center, and it has a lot of information about the pandemic unemployment benefits, and you can go towards the bottom of the page and it has where you can file your claim. Can you go to the next slide? These are the things that you're going to need when you apply. You have to have your personal information, which is easy to supply, like your social security number, your date of birth, your mailing address, your phone number. But you also need to have the information for all of your employers from the last 18 months. So the names, the address, the phone number, the dates of employment, and reasons you're no longer working for each employer. And there's some other information that you may need to apply as well that's listed on the slide. Go to the next slide. This is the claims process timeline that's been laid out by the Kentucky Career Center. So on day 1, you file your application. They say on day 2 that the Office of Unemployment Insurance will determine if you have a valid claim. And then on days 3 through 12, you will receive a letter that states the amount of your payment. Day 13, if there are no disqualifying factors, they'll generate the payment either by direct deposit or a debit card within 2 to 5 days. And then day 28, if you continue to be unemployed, you can request your second benefit payment. You can do so online with the address listed there, or you can call them. You can always check your claim status by going to the claims website and look at the account summary and see what the status of it is. I will tell you though, some people have gotten wrongful denial notices, either electronically or mailed to them. We've heard of people who got a notice both electronically and written saying that they were denied, but they were actually approved and they got a debit card with their benefit payment on it. So there are some issues in the system, but they're working really hard to get that worked out. If you go to the next slide. So when there's an issue, they are asking you not to file a second claim for the same one if there's some issue that comes up. But at the end of the day, if it ends up, this was a denial that you got and the unemployment office says it's a valid denial, you can appeal your denial. And it's a very fast time frame to be able to do that. You have to appeal within 15 days of the date of mailing of the determination. So the first stage of the appeals is to appeal with the Unemployment Appeals Branch. And the best way to appeal right now would likely be via email. And that's a really nice option. We have their email address listed on the slide. You can also fax it, or you could mail it. Now, I caution you on mailing the appeals unless you could send it by certified mail with return receipt requested, because you need to have a way that's trackable, that can track when you mailed the document and when it was received. So unless you send it by certified mail with return receipt requested, there's no way to verify that they actually received your decision, or, pardon me, your appeal. So if you email, you could put a read receipt on the email, or they may reply back to you promptly. And if you fax, you can get a fax receipt. So those are really safe ways to send in the appeal. On the back of your denial notice, or on the second page, however they print it off, it also gives you kind of a deadline that says you need to appeal by this date. So it's helpful to read the appeal procedures on your denial letter. When you send in your appeal, it has to be in writing. So you cannot just call the appeals branch and say, I want to appeal. You have to put that in writing. It has to list your name, at least the last 4 digits of your social security number, your claimant reference number if you have one, and your contact information. If you have questions about the procedure, you can always call the appeals branch with any questions that you have. There may be a delay in getting through to them, but their number is listed. And most importantly, if you do need to have a hearing, you can call your local legal aid and ask for representation for your hearing, and they will review your case.
Yeah, and this is Tyler Offerman. If, excuse me, I can just add, Stephanie already pointed out that the state is telling applicants who are applying for unemployment insurance that if you receive a denial letter, but you meet the qualifications that we've laid out, you likely do qualify, and any denial letters you get should likely be disregarded. Now, that's a really tough thing for me to say, because normally whenever we advise clients, if you get a piece of paper saying you've been denied, we want to sort of take immediate action on that. So please do contact your local legal aid office, reach out to one of us. I'll put our contact information to clarify. But if you go back over the groups that are newly eligible because of the changes made in light of the COVID-19 pandemic, and you meet those qualifications and you receive a denial letter, don't panic. You more than likely qualify. A worker is more than likely pulling your application out on the back end and manually approving it. Now, I wish we had clearer guidance and I could say clearly, if you're in this situation, yes. If you're in this situation, no. Unfortunately, things are really fluid right now. We've heard of clients who applied for unemployment 4 or 5 weeks ago and still have not yet received their payments. This is really unfortunate. We also understand that the state is dealing with unprecedented applications. So while we do want to be understanding of their situation, we also want to make sure that you get the help you need so that you can be made whole as soon as possible. So please do contact your local legal aid office or one of us for more information. Great, and then just want to make sure to add our contact information here if you do have any questions, concerns, or comments. That is all of the technical information that we had, but I did want to open it up just to any of our presenters. If you had any other last thoughts, comments, or things you would like to leave us with. Great. Well, I'll go ahead and add, like I said at the beginning, the safety net is meant for everyone. Before the COVID-19 pandemic, some of us were living in crisis and we needed that safety net. Many more of us are now finding ourselves in crisis because of this pandemic. The safety net is meant to be there. There should be no shame or stigma in utilizing these resources because they are meant for us in this moment. So please do reach out to any of us if you need assistance, if you have other questions, or if you just need someone to talk out your situation to make sure that you understand what is available to you. So with that, we'll go ahead and close this space. Thank you so much for joining.